Hi friends, I am Dr. Pratap Singh Rathore. I have done MD in forensic medicine and today we will continue with mechanical asphyxia. In today's video, we will discuss about common methods of homicidal strangulation. So in last video, we will discuss about strangulation. So in this video, we will discuss about other forms of homicidal strangulation. In this, we will discuss about throttling, panstola, mugging and garroting. Coming to throttling, it is also known as manual strangulation. Throttling is an asphyxia produced by compression of neck by human hands. So usually when we discussed about hanging and strangulation, it is done by ligature. Throttling is usually done by asphyxia produced by compression of neck by hands. So here death usually occurs because of occlusion of carotid arteries. Sometimes airway may be obstructed, which plays a minor role. Cause of death in throttling, mainly it is causes first is a commonest is asphyxia by obstruction of respiration. Then the cerebral anexia because of compression of cerebral arteries. Next is the vagal inhibition from pressure on the carotid nerve plexus, which consists of fibers of vagus, sympathetic and gasopharyngeal nerves. So as I mentioned in previous videos also, there is a chance that a stimulation of this lead to reflex vagal inhibition, where because of stimulation of this vagus nerve, fibers of vagus, sympathetic and gasopharyngeal nerves, it can stimulate the vagus nerve, and vagus, which innervates the heart, can cause stoppage of heart. Coming to postmortem findings in case of throttling, external signs mainly includes of abrasions and bruises on front and sides of the neck, which are commonly seen in the at the level of laryngeal prominence just below the jawline. Here, if pressure is applied, if the hand pressure is applied, there is clear signs of asphyxia may be seen. If mainly if the person compresses the neck prolonged period, if the trachea is obstructed prolonged, the classical signs of asphyxia will be seen. Other than that, if it is not, then the person may die because of cerebral asphyxia. So classical signs like cyanosis, congestion of face, tattoo spars is seen if it is prolonged period, if compression is prolonged. Bruises are mainly seen because of the tips of the fingers. They may be seen as a oval or round in shape, about 1.5 to 2 cm in size on either side of the neck. Presence of and extent of fingertip bruising depends on various factors. There may be bruising as well as nail scratch abrasions and depends upon the relative position of the victim and the assailant. So how the victim is present, whether the victim is present in the sitting position, lying down position, and how the assailant is attacked, all depends on the presence of where the fingertips bruises will be present, as well as nail scratch abrasions will be present. Next is the manner of grasping of the neck. If the victim assailant has grabbed from the front side, back of the neck, or side of the neck, is all depending on that, the bruises will differ, position will differ. Amount of pressure exerted. So if the pressure is exerted more, then the bruising will be common. If the pressure is less, then bruising will be less common. Whether single or both hands are used. If single hand is used, then the thumb and fingertips bruises will be present on the both side of the neck. If both the hands are used, then all over the neck the bruises will be present. And based on the sex, age, condition of vessels and nutrition of the individual also, the extent of bruising will differ. Next, condition of the nails of the assailant. If the nails of the assailant is prominent, then nail scratch abrasions will be more commonly seen. Bruising made by the tips of the thumbs are more prominent than with other fingers. Since thumb is more prominent, bruising caused by thumb is more prominent. Multiple abrasions on the neck may also result from use of victim's hands in an effort to dislodge assailant grip. Sometimes abrasions may also be present because of a victim's hand itself. So victim may try to grasp the hand, and by grasping it, he may cause the nail scratch abrasions on the near the neck. These curvilinear marks commonly lie close to the areas of bruising and are often horizontal oriented. So if you see a neck and there is one bruising seen in the side of the neck caused with the thumb, and multiple smaller bruises caused by the fingertips, maybe four may be present. Along this neck, there may be horizontal oriented nail scratch abrasions may be present caused by the victim's nails, but the assailant's nails may also cause scratch abrasions, which are present in the vertically placed, may be seen. So these are the vertically placed victims' assailant's nail scratch applications, and while trying to remove the hand, the victim's nail can cause the horizontally oriented curvilinear nail scratch abrasions may be present. So if the victim has used single hand, the thumb will be applied on one side and other fingers will be opposite side. For example, if the person has grabbed from the right, if the assailant is a right hand person, then on the right hand produces bruising of the pulp of pressure thumb on the anterolateral surface of the right side of the victim's neck. The thumb pressure abrasion will be present on the right side of the neck, and several fingertip bruising will be present, and nail scratch abrasion present on the left side. So this also indicates the position as well as the if the assailant is right-handed or left-handed. So in this image, you can see if the assailant is attacked from the if he is right-handed and if attacked from the front, then the thumb impression will be present on the right side, and and the fingertips will be present. 4 in number will be present on the left side, with nail scratch abrasion will also be present. So these are nail abrasions caused by the assailant. Sometimes, if the victim try to remove his hand, there may also cause a horizontal placed curvilinear nail scratch abrasions on the horizontal placed in the front of the neck. If assailant uses both hands, evidence of the pressure of thumb marks on one hand and finger marks on the other hand are also found on the other side of the neck. In case from the behind, pressure is applied all on the neck, but some areas of bruising may be prominent and others because of the pressing of fingers. So if the person has used both the hands, then both the thumb marks will be present in the front side, and uh, the fingertips will be present on the either side. And if it is used from the behind, then it will be present all over the neck will be seen. Because of struggle resistance, marking of bruising abrasions may be found over the face, nostrils, lips, chin, cheeks, forehead, and lower jaw of the victim. So, in case of throttling, homicidal strangulation, many times bruising may be seen on abrasions will be observed all over the face, nostrils, and lips, forehead. Internal findings. Coming to internal findings in case of death by throttling, there is extravasation of blood in subcutaneous tissue underneath the external marks of bruising. Abrasions is most significantly internal sign. So there is blood gets accumulated in the subcutaneous tissue. Tear and laceration of latissimus muscles may be present. Sternocleidomastoid muscle may be present. Tongue may be bruised or lacerated and may be protruded or bitten by the teeth during struggle. Then there may be hemorrhage varying from pinpoint ecchymosis to extensive extravasation found in the mucous membrane of larynx, epiglottis, pharynx, and peritonsilials, mainly because of compression caused by the hand. There may be hemorrhages may be seen in the other parts of the larynx, epiglottis, and pharynx. Inward compression fracture of hyoid is commonly seen. So hyoid bone will be fractured inwardly. So hyoid bone, which is commonly is cartilaginous, will be may get fractured if the person is more than 14 years of age. Already classification of hyoid bone may be formed. In that case, the greater hernia of the hyoid bone may get fractured, inwardly fracture may be present. So here the tip of the hyoid bone may be inwardly placed, which is diagnostic of throttling. Fracture of superior horns of thyroid cartilage is also common. In case if the victim, if the assailant is attacked, kneels on the chest, there may be rib fracture may be present. There may be laceration of carotid sheets and tear of inner coat of carotid artery may be also be seen. Cricoid is usually not fractured, and if it is fractured, it is commonly because of throttling only. Other signs of asphyxia in other organs may be present, which are mainly the presence of tardo spots, that is pinpoint hemorrhages. Then there may be congestion will be seen. So this will be seen only if the pressure is applied for prolonged period. Then only these signs will be prominently seen. Now coming to medical-legal importance, medical questions which has to be addressed in case of throttling. First and foremost, we have to know whether the victim, if the person had died because of asphyxia or because of ligature strangle, if death because of asphyxia, you have to know whether the victim has died because of like hanging, strangulation, or because of throttling. So if he has died because of throttling, there will be bruising and abrasions will be present. So bruising and abrasions, that is tip of the finger, tip of the thumb, and nail scratch abrasions will be seen, with rupture of neck muscles will be present. There may be engorgement of tissues at level of compression. Fracture of thyroid cartilage and hair bone will be present. So hair bone will be fractured, inward compression will be caused, will be present. Then general signs of asphyxia will be present. Then fracture of cricoid is almost pathognomic of throttling. So these are all signs, these are all findings will be present in case of death due to throttling, which indicates that the victim has died because of throttling only. Next is there may be chance of throttling may be suicidal, homicidal, throttling, whether the throttling is suicidal, homicidal, or accidental. Suicidal throttling is almost impossible since once the person starts to compress, the person will lose unconsciousness and the hand will lose the grip and he may release the pressure. So it is almost impossible to self-throttle. If homicidal throttling is the commonest mode of homicide, because hand is immediately available to and method of choice in case of infants. In adults also, signs of struggle usually present, but if throat is seized firmly and compressed, victim cannot struggle. In case the victim is intoxicated, in that case also, the signs of struggle will not present. So in case of intoxication also, findings will be less. If contusion and fingernail abrasions are present on the neck, the presumption must be of homicide only. So signs of struggle like fingernail abrasions will indicate that the person has tried to struggle and prevent compression. Accidental throttling may occur mainly in case like sudden application of one or both hands on a person's throat has a demonstration of affection, in joke, or a part of physiological experiment may cause death because of regular inhibition. So here the person may not have intent to cause death, intent to cause throttling. He may try to just grasp a neck, just a form of joking or affection or just an experiment, and there may be it may cause vagus nerve stimulation by in the carotid sheaths. So carotid sheath may have nerve endings which may get stimulated, leading to stimulation of vagus nerve, which may cause the heart to stop. Next question, medical question is whether how much the pressure has been used. So the victim or assailant may plead that he was not intended to kill. So if the pressure, so we have to know how much pressure is applied by based on how much there is bruising or hemorrhage is seen. So if there is damage to neck structure, it indicates that considerable force is used and intent to injure is present. So if there is a damage to neck structure, it indicates that there was some intent to injure, but he may not have intent to kill. If there is a fracture of hyoid bone, larynx, it indicates that appropriate force was used and the person had an intent to cause homicide in nature. So he had an intent to kill the person. Because of that, there is fracture of hyoid bone, larynx, and other structures. If only slight changes are seen in neck structures, then guarded opinion should be given whether the person was trying to kill or not, or provide heavy force is used or not. It becomes a controversial whether he has applied considerable force or not. Next, coming to other forms of homicidal strangulation. Next is a banstola. In banstola, one strong bamboo or stick is placed across the back of the neck. One bamboo stick is placed back of the neck, and other end is present on the front of the neck, and both the ends are tied and squeezed to the person is squeezed to death. Sometimes the skit may be present on the front of the neck and assailant may stand on the foot on each side. So on the neck, he may place a bamboo and he may stand on the other side of the neck. If a stick or foot is used, bruise is seen in the center of the neck across the windpipe. So across if the windpipe is used, if the person has stand or vanstola is made on the front, there will be present of imprint of the bamboo stick will be present on the front of the neck. And if both the sticks are used, and it will similar mark will be present on the back of the neck will be seen. Next is the garroting. So other than the signs which are commonly because of banstola, the mark will be present. Other signs of asphyxia, that is cyanosis, congestion of hormones will be seen. Now coming to garroting. In this method, a thin string is thrown around the neck of an unaware victim from the behind. Then ligature material is then tightened rapidly with the help of two sticks. So garrot is a method which consists of a stick in which there is a thread. This is thrown from behind the neck of the unaware victim, and the loop is tightened, squeezed, constricted suddenly or strongly. So assailant then able to tie the ligature with one or more turns. So based on the number of turns, he may try to compress the neck. So because of sudden compression, the person there is a sudden spike may penetrate the spinal, may injure spinal cord, leading to loss of consciousness and collapse. Garroting was also used as a mode of judicial execution once in Spain. Here, instead of wire, the victim was placed in the chair, was sitting in a chair, and there was a iron collar. So the victim was placed with the iron collar. So this iron collar was had a screw, and this screw was tightened, and this iron collar which to squeeze tightened by the screw. This was known as the Spanish windlash. Coming to next form method of homicidal strangulation is mugging. Here, strangulation caused by holding the neck of the victim in bend of the elbow. So, victim is held by the bend of the elbow behind the neck. Neck is held between the bend of the elbow. So, pressure is exerted either on the front of the larynx or on both the sides of the neck by the forearm and upper arm. So, based on how the pressure is applied, either the carotid arteries get compressed or the front of the neck get compressed. The attack is usually made from behind. The post-mortem appearance are those of ligature strangulation with broad object. So, since the person get asphyxiated, the signs of asphyxia present, then signs of ligature strangulation present, and if the compression is based on the way the compression is present, bruising will be present. Sometimes diffuse abrasion may be seen along the margins of the jaw due to friction of the forearm. So, since there is sometimes there may be friction, abrasions may be formed. Internally, there may be diffuse bruising, but this may be slight or absent. There may be bracing present behind the larynx and in the strap muscles of the neck. Fracture of superior horn of thyroid or hyoid is very rare since compression is mainly the compression of carotid arteries is seen. Death usually occurs because of asphyxia or cardiac arrest. Other than that, other signs of asphyxia in organs will be seen. These are my references. Thank you.